Hi, I'm Dr. Bret Byer from Fort Bend Periodontics and Implantology. And today we're going to talk a little bit about dental implants. I have patients come in literally on a daily basis asking, am I a candidate for dental implants? And I'm missing a tooth here or several teeth there. And will dental implants provide me a long-term solution to replace those teeth? So let's talk a little bit about what dental implants are and how they work. Dental implants are a titanium fixture. So today we use titanium implants, and they're the replacements for roots of teeth. For a tooth, the part that you see is the crown, and the part that's inside the bone is the root. So these dental implants replace the root of a tooth, and then a crown attaches to the top of them, or a bridge, or a denture, or different types of appliances that encompass one or more teeth. We've been placing dental implants. We've been keeping data on the implants that I've placed since 1991. And our success rate since 1991 has been 97%, which is a pretty good success rate. If you were to look in the literature, you can see it varies way up and down depending on who's doing them. In fact, in a literature search last year in the Journal of American Dental Association, it found that on average, dentists that are placing implants after 5 years, the failure rate can be as high as 20%. So our 28-year result now of 3% failure rate, 97% success rate is pretty incredible. So when you come in for an appointment and you've got some missing teeth, or you've got a tooth that broke, this has happened a lot over the Christmas holidays. During the holidays, regardless of which one it is, patients tend to get stressed out and they're clenching their teeth, or it's a high pressure time. It should be a holiday. You think should be a fun time, a party time, but for so many people it's a stressful event. You bring in all your extended family, everybody's in one area, and sure enough, people are clenching their teeth and things get broken, or you accidentally bite on something that breaks a tooth. And so when a patient comes in, the first thing we do is, one, we do an examination to make sure your gums are healthy and your teeth are in general healthy. And then we'll do a 3D x-ray. And we look at the anatomy of your jaws around that tooth that broke, or where the teeth are missing. And from that, I'll use a computer to actually plan your case. I'll place the implants on the computer, or plan the restorations on the computer. And before you come in for your next appointment to have an implant placed, we've actually used a 3D printer and made a guide so that we can place the implants exactly the way we planned it on the computer. And then the process, the next part of the process is we place the implants in your mouth. And if it's a anterior tooth, or a tooth you can see when you smile, we'll typically put temporary teeth. If it's a single tooth, or if it's a bridge even, we'll do a temporary bridge on top of the implant, so that when you walk out, you have a smile that day that's supported by the implants. And then we allow the bone to heal into the implants for a period of about 3 months on average, and then you get your final restorations. Dental implants are a great alternative. In the past, and decades before, a lot of people over time, if they broke a tooth, lost a tooth due to gum disease, whatever, there was lots of partial dentures and full dentures in the population. And the benefit of those, of course, is where they're pretty easy and fast to do, but the downside of those is they actually promote infection in your mouth. And so patients that wear partial dentures tend to lose their teeth over a period of time. Even when you have bridges, today dental implants are the standard of care, because when you have a bridge placed on your teeth, eventually the margins are going to leak and you get cavities underneath that bridge. And when you finally have symptoms, you typically lose one or more of the teeth that the bridge is connected to. You don't have that issue with the dental implant. When an implant's placed in the bone, it has a lot of benefits. One of them is it actually makes the bone harder around it. It prevents bone atrophy over time. And so it preserves your anatomy, preserves you over the course of time. Two, implants are, even in patients that grind and clench their teeth, things like that, implants are more durable than the traditional restorations. They don't chip or break. Typically, the new restorations on implants are made out of a material called zirconium, which is, it just doesn't chip. It doesn't break. It's easy to keep looking good over a long period of time. And from our perspective, really a dental implant should be a lifetime restoration, unless of course you don't, the things that may make you change them over the course of your life is if you have a bunch of other restorations done and you want everything to match the new restorations, you might change one on an implant. But implants are durable. They preserve the bone, they preserve your natural anatomy, and they're just a long-term approach. Different than the approach with a crown or a bridge. You know, those restorations tend to last 10 to 15 years and then they start leaking. You just don't have those issues with the dental implant. There is a cost associated with dental implants, but it's on par with the same. If you'd lost one of your front teeth and you were going to have a bridge, the cost of a dental implant is on average about $500 more than the cost of your bridge. When it's all said and done, you've paid all the bills and you're smiling in the mirror. The difference is the bridge tends to last 10 to 15 years and the dental implant should last a lifetime.